Hi, I'm Nick Freestone. I'm a cardiovascular physiologist at Kingston University. In simple terms, well, diabetes is the body's inability to use insulin appropriately. So either there's too little insulin in the body, or else there's too much insulin in the body and the body can't use that insulin. Insulin is used in the body so that the cells can take up glucose. So if you have trouble with your insulin in the body, you're going to have trouble getting glucose into the cells, and glucose gives you energy. Tricky, so if we're talking about type 2 diabetes, then that's associated with Western lifestyle, so you're likely to be inactive, lead a sedentary lifestyle, and to be overweight. So there are lots of complications to diabetes. So diabetes causes some diseases, and some diseases may lead you to develop diabetes. Diabetes is linked to metabolic syndrome, so things like heart failure and obesity and the metabolic syndrome itself are linked to diabetes. So in terms of signs and symptoms, somebody with heart failure may lead a lifestyle which leads to diabetes. But in terms of the symptoms of diabetes themselves, well, people are often thirsty, they're tired because of that energy deficit, because they can't take glucose up into the cells. So glucose, funnily enough, is damaging to cells. So if you have lots of glucose in your blood, because the cells can't take up the glucose because of the lack of insulin or the lack of effective insulin, then glucose floats around in your body, and too much glucose is damaging, especially to your blood vessels. So if you have high levels of glucose in your blood vessels get damaged. If you get damage to your blood vessels, you may have the risk of heart attack because the coronary arteries are damaged, or strokes because the cerebral arteries in your brain are damaged, or other parts of the body may be affected which are critically dependent upon blood flow. So if you damage blood vessels, you're damaging blood flow, and it can have very serious consequences for your body. It is lifestyle factors, so they are as effective as medication. So you can take medication, but alongside you should be doing lifestyle changes, so moderating your diet so it's not so energy dense. So cut down on your refined carbohydrates and fatty foods, but also physical activity. And those two things together, moderate amounts of physical activity, changing your diet, they're just as effective as any pharmacological intervention with drugs. The earlier you find out you have a disease, the earlier you can tackle it. So that's the problem with diabetes. It's been found, I've been involved in a study which shows that there are cardiovascular implications to diabetes before there's any functional effect on the heart. So that means the energy metabolism of the heart is changed, but the heart is still working properly. But if you look at these people inside an MRI machine or test their blood, you can see elevated levels of free fatty acids, elevated levels of glucose, and insulin resistance, even there's no symptoms. So they've got a problem with their energy handling in the heart, but the heart is still working functionally. Obviously, if that person isn't diagnosed early, it's going to progress, and then they're going to go into heart failure or have another heart disease. So the earlier you catch it, the better. So diabetic patients, they shouldn't get too stressed because it sounds like a very serious disease. It is a very serious disease, but it is quite easily tackled by lifestyle changes and diet, plus the medication. So it can something which can be reversed. So you can be diabetic and become non-diabetic just by these interventions. So it's not a life threat. It is a life-threatening disease, but it's not a lifelong disease if you tackle it appropriately.